guys, it's Brenda. I hope y'all are doing well. I have been missing in action lately, and I thought that I would explain a little bit of what I've been going through. So, first of all, the biggest item is my excessive fatigue that I go through with my chemo right now. This is one of the roughest chemos that I have been through. I have excessive nausea most of the time. I a lot of times can sleep 18 to 20 hours a day, which is not the best thing for me to do right now because then I'm not eating or drinking anything. But thank heavens to my feeding tube, I'm able to get some nutrition while I'm sleeping, because managing my weight in the past has been a little difficult, keeping my weight up high enough where I feel well enough. But lately a lot of the fatigue has just gotten the best of me, so I did a lot of sleeping. The other item that has been a little rough on me needs a little history first. So in 2015, I was diagnosed with breast cancer. I was put on one of the roughest chemos that they have. A lot of people even call it the red devil because it's so awful. It makes you so sick, and it is so rough to go through. I also, after that, went through radiation. A few weeks of that, 6 weeks, I believe. 90 days after that, my cancer had spread again, which is not normal. My doctor was kind of blindsided by this. Usually if cancer spreads, it's a lot longer than 90 days. This kind of told us the battle that we were going to be in for. So, fast forward to now, I have been on chemotherapy almost straight for 3 years. It has taken quite a toll on a lot of my organs. Some people who have stage 4 terminal cancer, like me, don't end up passing from the actual cancer itself. Some people actually end up passing from the organ failure, which is caused by all of the treatments that you need to go through. Now, I'm nowhere near that right now, but my organs do show a lot of issues. So, when you're on IV chemotherapy and oral chemotherapy, all of that is filtered through your bladder. No matter what chemotherapy you're on, it gets filtered out through your bladder. So my bladder has taken a very hard hit being on 3 years of chemotherapy. At first, my bladder started showing weakness. It just seemed like it was more difficult to get started. I never felt like I was completely empty, if that makes any sense. But I ended up going to a doctor because I started having pain. And as I was going to this doctor, they were trying to figure out what was wrong. One thing that they did find was that I in fact was not emptying. My bladder was getting weak. So they had me start catheterizing. I do in and out catheterizing, which means that I put a catheter in when I need to use the restroom, and as soon as I'm done, the catheter goes in the trash. I have a wonderful system for when I'm in a public atmosphere as well. We've had a hard time with my immune system, and part of the time my immune system has been down to only 1, which is basically nothing. So, I have to make sure that whatever I use, touch, or do is safe so that I don't have any severe issues or not be able to fight off a very bad infection. So the system that I have for catheterizing in public, there is a little sterile cloth. It's a little sterile kit, if you could say. There's a little cloth in there that I can lay down. A lot of times I don't even lay it down on a shelf in a bathroom or anything like that. I actually, when I turn around to stand up, I actually lay it on my wheelchair. It is waterproof and everything like that. Nothing can leak through it. So I lay that down to get all my stuff out and set it on there. And there's a little bag system that hooks on to the end of my catheter. So I don't even have to use the toilet. I have sterile gloves on. Who needs to use the bathroom with sterile gloves? That's just crazy. But anyway, I have to do it to prevent infection, even though I need to wash my hands before. So that is just a wonderful setup so that I can still be out in the public and go places without having to worry about a nasty bathroom when I do need to go. And I can still enjoy life. The other item that was coming up was excessive pain. We went to a urologist when this pain started. We kept going back. He had started me on some medications. The medications were not enough. He eventually did I want to say, can't think of the proper word right now, chemo brain is real. But they go up inside of you with a camera to look at your bladder and to see what's going on and if there is anything going on. What he found was that from all the chemo that has been filtering through my bladder, one of the chemos that I was on, we don't know which one, has caused this buildup along the entire wall of my bladder. Some of it is kind of dry, and he was able to pluck it off, thinking that it would give me some relief. The other part of it was very sticky, almost like trying to pull a piece of bubble gum off of the table after it's been chewed. So he said he couldn't get any of that off. We did this a couple times. I would have the procedure done under anesthesia. He would pluck off what he could, hoping it would give me some relief. Well, it only gave me maybe 2% relief. At this point, I was getting to the point where I was not able to leave the house because I was actually crying and screaming through going to the restroom. It was the most painful thing ever. Not only that, but I started going very, very, very frequently. And what was explained to me is that since all of this growth was on the wall of my bladder, let me back up a little bit. When someone needs to use the restroom, when their bladder gets full, the walls kind of say, oh, hey, your bladder's full. I need to start spasming in order to tell you you need to use the restroom so that you can go. Well, with all of this stuff growing on the walls of my bladder constantly thinks that it's full. So it spasms and spasms and spasms, and it doesn't stop. So all of the stuff on my wall continuously make my bladder think that it's full. So we got to a point where I was unable to handle the pain anymore. I didn't have quality of life, and it was just very, very, very rough. I remember my daughter even crying because she heard Mama screaming so many times per day. She was having a hard time seeing her mom in that much pain. So I did the best thing that I could do was comfort her and tell her, look, this is going to happen until we figure out what's going on. It's normal. When Mama's done going, she's okay. This is not anything drastic or awful or anything like that. So I tried to tell her that she didn't need to worry. It kind of eased her mind a little bit. One thing the doctor did do was take some of the sample off of my bladder and test it to see whether it was cancerous or not. And this yellow stuff that grows on my bladder came back not cancerous. That was some of the best news that we had, because some of my doctors, nobody had ever seen this before. The doctor who was trying to treat me had never in his years, and my urologist is not young, so he's had quite a few years of being a urologist, and in over 30 years he's never seen this. So we decided at one point that we needed a second opinion. We decided that since he didn't know what it was, we didn't know how to treat it, we didn't know what else to do, he decided that I should go to one of the top hospitals. In fact, the top hospital that we have in the entire state of Tennessee. It's actually a Trauma 1 center where helicopters come in and fly people all over for just horrible accidents and things like that. So we went there. I saw a urologist there. He put me on some different medications. Those were not working. While after my appointment, he looked at a whole bunch of my pictures and things. Apologize for my dog barking in the back room. He kind of came to me and said, look, I know that you came to Vanderbilt for some answers, but I've never seen this before either. This is one that may get put in the books. So he said, I'm going to send you to the absolute top urologist so that you can see him, and hopefully this will explain the situation and what you're going through, or at least we can find another treatment to give you some relief and some quality of life. Because not only was I sick, fatigued, vomiting, just feeling awful from my chemotherapy, but I was also screaming and crying during every time I went to the restroom. This was just so much that it took a toll on my positive attitude. But I did my best to keep a smile on my face and keep going. So I told him that I was catheterizing, and he went over all of that, said, yes, you're not emptying. You do need to catheterize every single time you need to go to the restroom, because with being on chemo, my immune system is very, very low, so any urine sitting in my bladder could form into a very bad infection that I can't fight off. He also told me that with catheterizing and being on chemo, this usually isn't a situation that they see all the time. So I have been told that there is just no way at all of preventing infections. And I have been hospitalized quite a few times for urinary tract infections. I am even cleaning with the top scrub that they scrub you up with, the orange ugly stuff that they scrub you with for surgery. They're having me use that to clean myself, and even with that, I guess some teeny tiny little piece of bacteria gets in somewhere and causes an infection. It gets to my kidneys very quickly because I don't have an immune system to fight it off. And unlike most people who can go to the doctor with a UTI, get some antibiotics, and go home, I'm not able to do that. It causes a high fever and spreads very quickly. I've even become septic from it. So now they test my blood all the time when I go to the hospital to see if I'm septic yet. And they do that throughout my stay to see if it's getting worse. So the doctor finally came up with a plan. And the plan had pros and cons. We didn't know if we should try it or not, but what could it hurt? I was already in so much pain. The other doctor that I was seeing in my own hometown had told me that my only option was to have a suprapubic surgery, which means that they bypass your bladder and they put a tube coming out of you around your bikini line so that nobody can really see it. And that's how you empty, is through a tube at your bikini line. It skips my bladder so that I wouldn't have any pain. When I talked to my oncologist about this, she told me that I would need to be off of chemotherapy the week before the surgery, during the surgery, and 2 weeks after the surgery to heal. Meaning I would need to risk having a tumor and having my cancer spread in order to have this done. That was very hard because at the time we were wondering if that was the only thing that we could ever do. Because right now I have been through all of the top chemotherapies and I do not have any of the strong top chemotherapies left to try. So when my cancer does decide to grow again and spread, right now we're kind of in a stable pattern, kind of. But when it does spread again, I don't have a whole lot of options left. So that was not something I was going to risk. I have a 13-year-old daughter who absolutely means the world to me. She's the reason that no matter how sick I am, I spend time with her every day, every night when she's home from school. She's beautiful and I love her so much. Not only that, but I have an absolute wonderful husband who has basically sometimes worked night and day. He works all day long and then takes off-duty jobs at nighttime. I can't risk losing any time with my wonderful family. They mean so very much to me. So, the new doctor at Vanderbilt, when he came up with this new idea, and I found out I didn't need to stop my chemotherapy for this procedure. It's a surgical procedure. You go under anesthesia. I thought that that was my best chance for more quality of life. So we told him to go ahead. I was so ecstatic that I told him to go ahead even before he finished explaining all of it. Basically, well, a lot of people have, they want to fix little imperfections on their face. So they go and they have a thing injected into their face called Botox. They trying to make themselves perfect. I'm not into that. This is who I am. But apparently my doctor told me I need Botox. And that sounds really funny. But they have discovered that when Botox is implanted into the wall of the bladder, within 4 weeks it hardens and it stops the bladder from spasming. So mostly the painful part is all the spasms. So if I'm catheterizing and my bladder doesn't spasm, this sounded like too good to be true. We started off with a low dose. I did see some improvement, but not enough. So he started off with a middle dose. That didn't work either, although I got more relief than I did the first time. We eventually tried another, which is the highest amount of Botox that you can have in a 12-week period by your insurance and by the FDA. The bad part is that this procedure has to be done every 12 weeks. If it goes over 12 weeks, the Botox is completely worn off, and I am right back to screaming and crying. This last time that I had it done took me down for a few extra days because when they put the 300 milligrams, which is the max dose, into my bladder, they just do hundreds and hundreds and hundreds of little pokes throughout your entire bladder. It bleeds a lot throughout the next week. So I do lose a lot of blood when I use the restroom and catheterize after the procedure. But this time, since I didn't have any Botox built up, it was actually supposed to happen in November. But at the time of my surgery, I had a urinary tract infection and got admitted to the hospital. After my hospital admission and I was free of infection, I called to see if I could get in as soon as possible. Well, at the end of the year, the operating rooms and everything are absolutely packed for so many people wanting to get surgeries done before the end of the year so that they don't have to start over and actually pay if they haven't met their deductible. So the soonest that I could get it done was last week on Wednesday. So I'm still resting a lot and tired. I'm extra tired today because I had Benadryl. I had some scans today. But I promised you guys I would get this video out, so I'm working hard to get it done, and I'm going to try and edit it in the next 1 or 2 days. But when I had this last procedure on Wednesday, the 300 milligrams of Botox in my bladder, when I woke up, I don't think I have ever screamed that hard in all of my life. The nurse catheterized me because I was screaming, saying I needed to be catheterized. So she catheterized me, but she pulled it out right away. And my bladder was so mad from all of the spasms. It was having spasms, severe spasms from all of the injections. And the Botox is not hard in my bladder yet. It takes up to 4 weeks. So right now my bladder's allowed to spasm. I will have relief in about 2 to 3 more weeks. So, but I was screaming and screaming and screaming. I told her to go get my husband. She said, "If I get your husband, will you shut up? There are other patients in here." I was in so much pain, the most pain of my life. I couldn't even scream loud enough to comfort myself from all of the pain. It was so awful. I was crying. Finally, my husband came and I explained to him that she wouldn't catheterize me again. She keeps telling me, "I already just did it. You don't need to go again." I tried to explain to her my situation and she still didn't understand, so my husband handed me a catheter out of my own bag. I actually put it in myself and left it there and actually fell asleep because my bladder didn't hurt and wasn't spasming because it was just emptying right away. But now I am finally on the mend and things are getting a little bit better. So I do my best to try and make one video per week, because it's a little rough. It takes me quite a few hours to edit, but I'm doing my best for all of you to understand what it's like to live with terminal cancer. And this has been my crazy, weird situation. My husband always tells me that I'm unique. I have had so many times where I've gone into a doctor's office and they tell me, well, I've never seen this before, or this usually never happens, or, well, this is new, or, you know, it's always something unique. So my husband always tells me I'm unique, but I love my family. We're fighting together, and I couldn't be more happy to have all of the support of my family and all of you. So one of the things that I always say is that every day, and I did see this quote somewhere else, so not totally mine, but it's so true to my situation. Not every day is a good day, but there is good in every day. So find that silver lining. If you're crying all day or you're going through cancer yourself, there is always something good in every day, and I hope that you can calm down and sit and find out what that is, whether it's that you got another day, or you have a wonderful family, or maybe you're just stabilized right now. But whatever it is that you're going through, I pray for you and I hope that you find that silver lining. Sending love from me to all of you. Thank you.